Hey guys, welcome back to the channel. If your dog has been scratching, licking their paws nonstop, or you've noticed red patches, bald spots, or that not so pleasant smell coming from their skin, this video is for you. Today we're talking about one of the most common reasons dogs come into my clinic, skin allergies. And trust me, this is something almost every dog owner will deal with at some point, so stick around because I'm going to break down exactly what's happening, why it happens, and what you can actually do about it. So let's start with the basics. When we say a dog has allergies, what we really mean is that their immune system is overreacting to something that shouldn't normally be a big deal. Think of it like this. Your dog's immune system is supposed to protect them from real threats like bacteria, viruses, parasites, but in an allergic dog, that immune system gets a little confused. It starts treating harmless things like pollen, dust mites, or even a protein in their food as if they're dangerous invaders. And when that happens, the body releases histamine and other inflammatory chemicals, and that's what causes all that itching, redness, and discomfort we see on the skin. Now, there are actually three main types of skin allergies I see in dogs, and it's really important to understand the difference because the treatment approach can be quite different for each one. The first type is what we call environmental allergies, or atopic dermatitis. This is when a dog is allergic to things in their environment: pollen, grass, dust mites, mold spores, even human dander sometimes. This is very similar to hay fever in people, except instead of sneezing and watery eyes, dogs show it through their skin. That's a really important point to remember. Dogs don't usually get a runny nose from allergies like we do. They get itchy skin. You'll often notice these dogs scratching a lot around their face, their ears, their armpits, their belly, and between their toes. And a lot of the time, this type of allergy is seasonal, so you might notice it gets worse in spring or autumn when pollen counts are high. Though some dogs react to dust mites, which are around all year, so their symptoms are more constant. The second type is food allergies. Now I want to clear up a big misconception here. Most food allergies are not actually caused by grains like wheat or corn, even though a lot of pet food marketing wants you to believe that. The truth is, the most common food allergens in dogs are actually proteins, things like beef, chicken, dairy, and sometimes egg. So when a dog has a true food allergy, their body is reacting to a specific protein source they've been eating, often one they've been eating for a long time. That's the funny thing about food allergies. Dogs usually don't develop them from something new. They develop them from something they've been eating for months or years, because the immune system needs repeated exposure to build up that allergic response. The third type is flea allergy dermatitis, and this one is honestly one of the most intense allergic reactions I see. Some dogs are so sensitive to flea saliva that literally one flea bite can set off days of intense itching and skin inflammation. And this is important because sometimes owners tell me there's no way my dog has fleas. I never see any. But with flea allergy dermatitis, you often don't need to see fleas crawling around. Because the dog is so allergic, a single bite is enough to cause a massive reaction, and the flea might have already jumped off or been groomed away by the time you check. Okay, so now that we understand the three types, let's talk about what these allergies actually look like on your dog, because this is what most owners come to me worried about. The most obvious sign is itching. We call this pruritus in the vet world, but it's not just scratching with the back leg. Allergic dogs will lick their paws obsessively, sometimes until the fur turns a rusty brown color from the saliva staining. They'll rub their face along the carpet or furniture. They'll chew at their flanks or their tail base. They'll shake their head a lot, which often means their ears are involved too. Because allergies very commonly cause ear infections in dogs. That's actually one of the most under-recognized signs of allergies. If your dog keeps getting recurrent ear infections, allergies are very often the underlying cause. Beyond the itching, you'll often see red, inflamed skin, especially in those areas I mentioned: armpits, groin, belly, between the toes, around the eyes and muzzle. Some dogs develop what we call hot spots, which are these angry, moist, red patches that seem to appear overnight and can get quite large quite quickly because the dog just won't stop licking and chewing at the area, which makes it worse, which makes them itchier, and it becomes this vicious cycle. You might also notice hair loss, especially in patches where the dog has been scratching or chewing consistently. The skin underneath can become thickened and darker over time. We call this hyperpigmentation, and this usually happens with chronic, long-term allergies where the skin has been inflamed repeatedly. Sometimes the skin gets greasy or develops a yeasty smell, because allergic skin is much more prone to secondary infections from bacteria and yeast. This is actually a really important point. A lot of what looks like the allergy is actually a secondary infection that developed because the allergy compromised the skin's natural barrier. So when dogs come in with bad allergic flare-ups, Very often, I'm not just treating the allergy itself, I'm also treating a bacterial or yeast infection that developed on top of it. Now let's talk about how we actually diagnose what's going on, because this is where a lot of owners get frustrated. And I understand why. Allergy diagnosis in dogs is not always straightforward, and it often takes some detective work. When a dog comes in itchy, the first thing I do is rule out the simple stuff. Fleas, even if you don't see them, we treat for them, because it's cheap, easy, and if the itching resolves, we've found our answer. We also check for mites, like sarcoptic mange, which can look very similar to allergies but is actually caused by a microscopic parasite and is treated completely differently. We do skin scrapes under the microscope to check for these. Once we've ruled out parasites, we start thinking about whether this is environmental or food related. Now here's something that surprises a lot of owners. There's no simple blood test that reliably diagnoses food allergies. I know some companies sell these tests, but the gold standard, the actual proper way to diagnose a food allergy, is something called an elimination diet trial. This means feeding your dog a novel protein or a hydrolyzed protein diet, something their immune system has never been exposed to before, for a strict 8 to 12 weeks, with absolutely no treats, no table scraps, no flavored medications, nothing else. If the symptoms improve significantly during that trial and then come back when we reintroduce the old diet, that confirms a food allergy. It's a bit of a commitment, I know, but it's really the only reliable way to know for sure. For environmental allergies, we do have some options like intradermal skin testing or blood tests that look for specific IgE antibodies against pollens, dust mites, and molds. These tests are really useful, especially if we're considering something called allergen-specific immunotherapy, which I'll talk about in a bit, because that treatment actually needs to know exactly what your dog is allergic to. Now let's get into what I know you're really here for, treatment. How do we actually help these dogs feel better? The first thing I always say is allergies are very rarely a cure situation. In most cases, we're managing a chronic condition rather than curing it completely, especially with environmental allergies. But the good news is, with the right management plan, the vast majority of allergic dogs can live very comfortable, happy lives with minimal symptoms. Let's start with flea allergy, because honestly, this is the easiest one to manage. Strict, year-round flea prevention is non-negotiable for these dogs. Even one bite can trigger weeks of misery for a flea-allergic dog. So we're talking about consistent use of a good quality flea preventative every single month. No gaps, no skipping doses. I usually recommend the newer oral flea preventatives because they kill fleas fast enough that the flea doesn't even get a chance to bite properly and inject that allergy-triggering saliva. For flea-allergic dogs, this single step alone can make a massive difference. For food allergies, once we've identified the trigger through an elimination trial, management is actually pretty straightforward. You avoid that specific protein for the rest of the dog's life. This might mean switching to a diet with a novel protein your dog has never eaten before, like kangaroo venison or duck. Or it might mean using a hydrolyzed diet, which is a prescription diet where the proteins are broken down into pieces so small that the immune system can't recognize them as allergens anymore. The tricky part with food allergies is being really strict about it. No sneaky treats from the kids, no table scraps, because even small amounts of the trigger protein can set off symptoms again. Environmental allergies are the trickiest to manage because, let's be honest, you can't really remove pollen from the environment. So for these dogs, we usually take a multi-pronged approach. First, there's symptomatic relief, medications that reduce the itching and inflammation. This includes things like anti-inflammatory medications, and in more modern veterinary medicine, we have some fantastic targeted therapies now. There's a medication that works specifically by blocking the itch signal at the source, and there's also an injectable option that works similarly, giving relief for about a month at a time. These have honestly revolutionized how we manage allergic dogs because they're much more targeted than older treatments and have a really good safety profile for long-term use. Steroids are also an option and they work quickly and effectively, but I generally like to use them for short-term flare-ups rather than long-term management, because long-term steroid use can have side effects like increased thirst, increased appetite, and potential impacts on the liver and other organs over time. So if your vet has your dog on steroids, it's worth having a conversation about whether there's a more suitable long-term option available now. Antihistamines are sometimes used too, though I'll be honest with you, they tend to be much less effective in dogs than they are in people. Only about a third of dogs get good relief from antihistamines alone, so they're often more useful as part of a combination approach rather than a standalone treatment. For dogs with confirmed environmental allergies who really struggle despite these treatments, there's also allergen-specific immunotherapy, which is essentially an allergy vaccine tailored to exactly what your dog is allergic to, based on those skin or blood tests I mentioned earlier. This involves giving small, gradually increasing amounts of the allergen, either through injections or oral drops, to slowly desensitize the immune system over time. It takes months to start working and often a year or more to see the full benefit, but for the right candidate, it can significantly reduce or even eliminate the need for other medications long term. It's a bigger commitment, but for dogs with severe year-round allergies, it can be really worthwhile. Beyond medications, skincare itself plays a huge role in managing allergic dogs. Regular bathing with a gentle, medicated shampoo can physically wash away allergens sitting on the coat and skin, soothe irritation, and help control the secondary yeast and bacterial infections we talked about earlier. I often recommend bathing allergic dogs every 1 to 2 weeks, sometimes more frequently during flare-ups, using shampoos with ingredients like chlorhexidine, oatmeal, or ceramides depending on what's going on with their skin specifically. Just make sure you're using a shampoo actually formulated for dogs and ideally one recommended by your vet, because human shampoos and the wrong pH products can actually make things worse. Diet also plays a supporting role even outside of true food allergies. Omega-3 fatty acids, found in fish oil, have real anti-inflammatory benefits and can help strengthen the skin barrier, making it more resilient against allergens. A lot of good quality allergy support diets now have these built in, along with added skin barrier support ingredients. Managing secondary infections is also a big part of the puzzle. If your dog's skin has become infected with bacteria or yeast because of chronic scratching and inflammation, that needs to be treated directly too, often with topical treatments or, in more significant cases, oral antibiotics or antifungals. And honestly, treating that secondary infection often brings really fast relief for the dog because a lot of the smell, greasiness, and intense itching can actually be coming from the infection sitting on top of the allergy, not just the allergy itself. I also want to talk about ear care because I mentioned earlier that allergies are one of the biggest causes of chronic ear infections in dogs. If your dog is an allergy sufferer, keeping on top of regular ear cleaning with a proper vet-recommended ear cleanser can really help prevent those infections from taking hold, and catching any redness, odor, or head shaking early means we can treat it before it becomes a painful, full-blown infection. Now, I know a lot of you are probably wondering, is there anything I can do at home to help my dog right now if they're having a flare-up? A few things I always suggest. First, a cool bath can provide immediate relief for itchy, inflamed skin, kind of like how a cool shower feels good on a sunburn for us. Just make sure the water isn't too cold and pat the skin dry gently rather than rubbing. Second, an Elizabethan collar, or one of the softer, more comfortable cone alternatives now available, can help stop your dog from making things worse by constantly licking or chewing at an irritated spot while you're working with your vet on the underlying issue. And third, keep your dog's nails trimmed short, because a lot of the skin damage in allergic dogs actually comes from the dog scratching so hard they break the skin, and shorter nails reduce that trauma. I do want to say something important here though. While there's a lot you can do at home, please don't try to fully diagnose and manage significant allergic skin disease on your own, especially if your dog is really uncomfortable, has open sores, or the problem keeps coming back. Skin issues in dogs can look similar on the surface but have really different underlying causes. What looks like a simple allergy could be a hormonal condition, an autoimmune disease, mange, or something else entirely, and getting the wrong treatment can waste time and let the real problem get worse. A proper vet visit lets us actually examine the skin, do the right tests, and build a treatment plan specific to your dog rather than guessing. One more thing I want to mention because I get asked this a lot: can allergies develop at any age, or is it something dogs are just born with? Most environmental allergies actually show up when a dog is quite young, typically between 6 months and 3 years old. It's fairly unusual for a dog to suddenly develop environmental allergies for the first time when they're 8 or 9 years old, if that happens. We usually want to look a bit more carefully to make sure there isn't something else going on. Certain breeds are also much more prone to allergies than others. Breeds like French Bulldogs, Golden Retrievers, Labradors, West Highland White Terriers, Boxers, and Sharpies tend to be overrepresented when it comes to allergic skin disease, likely due to genetics affecting how their skin barrier functions. And speaking of skin barrier, this is actually a really important concept in modern veterinary dermatology that I want to touch on. We now understand that allergic dogs often have a skin barrier that isn't functioning as well as it should be. Think of the skin barrier like a brick wall, with skin cells as the bricks and fats called ceramides as the mortar holding it all together. In allergic dogs, this barrier tends to be a bit leaky, which means allergens can penetrate more easily into the skin, and moisture escapes more easily too, leading to dry, more reactive skin. This is why a lot of modern allergy management isn't just about blocking the allergic reaction, but also about actively supporting and repairing that skin barrier through specific shampoos, skin barrier supplements, and diets formulated with that in mind. I also want to touch on something that often gets overlooked, which is the emotional and behavioral side of chronic allergies. Dogs who are constantly itchy don't sleep as well. They can become irritable, some become more withdrawn, and the constant discomfort really does affect their quality of life and yours too, especially when you're up at night hearing them scratch or lick. This is exactly why I take allergies so seriously in practice. It's not just a cosmetic skin issue, it genuinely affects a dog's well-being day to day, and getting it properly managed can make a huge difference, not just to their skin, but to their whole demeanor and happiness. So to wrap this up, if there's one thing I want you to take away from this video, it's that skin allergies in dogs are incredibly common, but they are manageable. The key steps are figuring out which type of allergy or combination of allergies your dog has, working closely with your vet to build a proper long-term management plan, rather than just chasing quick fixes, staying consistent with flea prevention, and being patient, because managing allergies is often a journey of small adjustments rather than one single solution. If your dog is dealing with itchy, red, or irritated skin, please don't just wait it out or guess at home remedies. Book in with your vet, get a proper examination, and let's figure out exactly what's going on so your dog can get back to being comfortable and happy. Alright guys, that's it for today's video. If you found this helpful, give it a thumbs up, subscribe if you haven't already, and let me know in the comments what specific allergy questions you have about your own dog. I read every single comment, and a lot of my future videos actually come from questions you guys ask down there. Thanks so much for watching, and I'll see you in the next one.